Hello. So
Yeah.
this side Deepak and Lokesh sir. So today the discussion point will be about the Ayurveda. Actually, Ayurveda through need. Can you sir explain about this branch?
So first thing, Ayurveda, or to do Ayurveda, UG, the name of the UG degree is BAMS, which is Bachelor of Ayurvedic Medicine and Surgery.
BAMS is the short
Short.
actually.
So BAMS is short name, so Bachelor of Ayurvedic Medicine and Surgery. And this is a doctoral degree. You will be entitled as a doctor only. You are legally entitled as a doctor. And next thing, how to go all those things. So
So the idea is simple basically, like apart from the MBBS, there are multiple fields are there.
correct.
Okay. And one by one, we want to discuss about each and every field, opportunities, the drawbacks, and the colleges, how to get into it. So Ayurveda is one. Ayurveda is also one. So first of all, like how to get.
So to get admission into the Ayurveda colleges, everyone has to write NEET exam. NEET exam is the only compulsory exam which you have to write to get into Ayurveda colleges. And your marks should be above the cutoff percentage, which is around 100, 110 is the NEET exam.
So once you cross the cutoff, then you're entitled to get the
Ayurveda
college,
degree.
depending upon whether you get which college you
Yeah,
get.
private,
You get a
government, or
private
which
or government.
seat you are getting, everything that will be depending on the marks.
If you don't clear the cutoff, then there is no way you can get. That's
Okay.
for every, I think, medical.
Yeah, same thing for
MBBS, PET and all.
Yeah.
Now,
Huh.
there's no way you can get the seat in India without writing the NEET exam and qualifying.
Legally, you cannot get.
We are talking only legal right now only. So NEET is the criteria.
Correctly.
To get into Ayurveda. So let's first talk about the past, how it is happening. What's the trend generally? When somebody is like writing the NEET exam and they're getting the rank, what's the trend of choosing the branches?
So first, always people go for medical seats or
MBBS.
allopathy. Allopathy people are offering MBBS. They are going for MBBS seats. Second choices will be Ayurveda and veterinary. They are around same. You'll go for
BDS is also there.
BDS, Ayurveda, veterinary. BDS, see, initially it was more. Now also, at least not
Still
now.
the second.
Still, people are going for BDS. People are going towards the BDS. After that, they go for Ayurveda or veterinary. And both of the fields, Ayurveda or veterinary, if we'll talk, both of them around having a same cutoff.
Same cutoff. Generally, I went through the Karnataka. Approximately 5 lakhs times the people generally.
Correct.
Get.
You can
Depending upon the your
dependent like
which college you want to go for or which category you have, depending upon that.
General category, SC, HT, whatever you have, based on it. But 5 will be there. Like with some category, you can get the college at 5 lakh, 6 lakh.
What about the colleges?
So colleges, sir, all India don't have very much colleges of Ayurveda. We are still having a less 20-25 all India colleges.
Just like
I'm talking about the government colleges.
Government college.
And addition, you can make like more 50 colleges or private colleges. So the range 70-75 colleges will be there to combining. In that 20-25 government colleges are there. So if I talk about the most old college or a top college for Ayurveda, which everyone knows, that is BHU. BHU belongs to the Banaras University and is a very good college. They're the most preferred college in Ayurveda. Second, you can go for NIA, National Institute of Ayurveda is there, which is located in Jaipur. Third, there are colleges like All India Institute of Ayurveda in Goa. And then we have in Bangalore also, we have colleges of government colleges. Bangalore also a very good government college, Rajiv Gandhi Institute. Then,
but the course is same everywhere.
Same
Generally,
everywhere.
I also know, like generally what happened when we talk about the ranking of the college, generally it is more connected to the historical aspect.
Correct.
So
More
the
colleges
colleges are old basically, so the alumni is there in the market. So alumni keep saying it.
Correct.
So you will find more people who have done the Ayurveda from the BHU. If anybody wants to go for the Ayurveda, the more people will be there. We'll be talking about BHU.
And because you see, same thing, if alumni are already there, they are related in good field already. So your future prospects are also good if you are from old Ayurveda colleges. Fields may the people will be there already from your college.
Generally, we get a lot of help from the seniors and all.
Then talking about the course structure. So course structure, it will be around same as MBBS.
5.5 years.
5.5 years the course will be there. 4.5 will be theory expect, and 1 year will be the internship expect.
1 year internship will be there. 4.5 years basically theory part will be there. Internship, do they get some?
They get the stipend. Stipend will be there every month, depend on the different colleges.
Same as the,
around the same as MBBS only, and depending on the different colleges which they are.
Okay.
So
different college will be depending on the different allowance amount.
Correct. So depending on the different government college, private college, whatever they are getting, in that they will get the fixed stipend amount will be there.
Okay.
Second thing about this is the years is the 1 year of the Ayurveda college or Ayurveda degree is 1.5 year actually. Like there are only 3 years. Each year comprises of 1.5 year, 1.5 year, and 1.5 year.
Okay, so only 3 times they have to write the exam.
So annual exams will be only 3 times.
Okay. So that's a benefit as well as loss as well.
Both will be there. So
only 3 exams are there, so this is a benefit. But since 1.5 year,
you are simply chilling and not studying. So
yeah.
there will be pressure.
So
and
one has
pressure.
to keep remembering the things which they have learned like
Yeah,
1.5 year back.
All
Okay.
that's other prospect. Then, sir, if I talk about the course details more, not slightly.
Because yes, course, because I know when you are doing the Ayurvedic degree, you are BAMS basically, you finish the BAMS, you are equivalent to the MBBS doctor. Legally equivalent to MBBS doctor. Like BDS doctor, they can prescribe only for teeth, but not less on things. But only can prescribe for veterinarians. But the Ayurvedic doctors can prescribe for human, even the allopathic medicine.
Correct.
Legally.
Correct. They can prescribe legally also.
And so like this field, like MBBS is open for the Ayurvedic doctors as well. They can enter depending upon their caliber. Ultimately. Correct. Caliber and the following.
How much they have knowledge.
Because in medicine, degree se zyada, sir, depends basically how good doctor you are.
How good
what kind of experience you have.
Like how much you can correct your patient.
Yeah.
That's only one thing matters. So these are things. And one more thing, sir, like people think generally ki in Ayurveda you are reading for some jadi booty or something like that.
I was one of them.
So it's not like that, sir. The course structure will be around same as MBBS only. There will be physiology, human physiology will be there. Human anatomy will be there, microbiology, all those things will be there.
That's why they are legally allowed.
Yeah,
because they are studying everything which the allopathic student is studying.
Correct.
Apart from that, they will be studying little extra.
So the Sanskrit will be there, Panchkarma therapy also. There are many things which are added, but the basic things will be same like MBBS only. They know the basic human physiology.
It is not like that government like the Ayurveda to make them to join the allopathy as well. The course structure is same.
It's like they have basic knowledge about all the things. It's not like they only know about jadi booties and all. It's not like that.
At the same time, every medicine is derived from there.
Some initial, if you go like 50 years back, maximum medicines have the derived only. Now we have some lab calculations we have made, so that is fine thing. But initially, all maximum medicines are plant derived. So it's there.
So that's a very good point. Actually, good opportunity if you're not getting the MBBS and you don't want to repeat. Then go for Ayurveda.
Or you don't want to go outside the country.
Outside, I never suggest actually. Going outside, doing MBBS from the Russia, Ukraine and all, then getting fail here.
Again here.
Multiple times.
Again here, writing exams. So if I'll tell you, 6 years degree, they have to complete there. 1 year internship, they have to complete here after giving the test paper. If they're not pass and test, again give the test after 1 year.
And it's very difficult. Very low ratio.
Very low. Like example, if 100 students are coming, only 15, 20 students are getting passed out from that paper.
So do the Ayurveda from the India itself, and then basically you can immediately start going for this
allopathic and move on, sir.
I'm just right now, if you only focus on allopathy, the rest of the things are also there. But if somebody wants to only follow the allopathy,
the best option is you can do the MS in the Ayurveda. So you can do the surgery in Ayurveda, and then you are the legally entitled person. You are surgeon. You are allopathic surgeon only, because 4-5 years back, government has made this already a rule. After Ayurvedic surgeon is same as the allopathic surgeon.
So basically, there is no drawback.
There's
no surgery. You want to be surgeon in allopathy, you're not getting it. Go in the Ayurveda, because there the masters will be quite easy actually. It will be quite, because competition is pretty large.
That's correct.
You complete it and then you join the hospital. And hospital ultimately they'll be checking not the degree but your ability. They are checking how good you are ultimately and what kind of relation you can make with your patients. Those are the things which matter at the later stage, not the college. In case of medicine, not the college, but these things matters a lot. At the same time, like many parents I know basically who are sending their kids outside, not because they are not getting the seats in India. Many are getting the seats for the private seats. Correct. MBBS seats. And private MBBS seats, they are costly. So if you're going for it, generally the cost comes around like 5.5 year course comes around 50, 60, 70 lakhs.
It can range from
it can go more as well.
150 to 1 CR will be the around range will be there.
So that is the reason many parents send their kids outside, because there is cheap. In 20-25 lakhs, everything is complete. But as I was going through the data, like if you
Ayurvedic
get
college,
in
private-
Ayurveda, if you get the government college, oh, it's
very
dirt cheap.
Dirt cheap,
It's
correct.
dirt cheap. Even the private colleges, the very good private colleges, 5.5 year
18 lakh, 17 lakh, max to max 20 lakhs.
for the 5.5
Full.
year.
5.5.
So basically, if somebody wants to send their kid outside because they are not getting the less fees, go for the
Ayurveda.
Ayurveda in India. They don't
Private
have to write the extra exam. Go
Yeah.
for the private one.
No
Go for
problem.
the private one. Basically, the fees will be
There,
less than the
there are good private colleges, sir.
Yeah.
Which are good private colleges here.
Ayurveda is a new field. You have to be good if you want the kids, basically.
Correct.
You have to be good. It's not in the demand in case of Ayurveda is so much, even the bad college will fail.
Correct.
In Ayurveda, this will not be happening. You have to perform. If college is good, then only they'll be able to
Yeah,
attract.
you have to perform in market. That's the main thing.
Then, so generally, I keep suggesting my kids not to go outside to perform because you finish it, you come back, you keep failing again and again. And then somehow if you are getting passed out, then again, people will be taking you as outside. And
Correct.
people will always take it like you didn't get the selection in India.
So that's
That's
why
why
you
you
went outside.
They will not take it this way. You went outside because in India, everything was very, very,
Very
costly.
costly, or maybe it's very the competition is very high in India.
Yeah.
So,
So Ayurveda, people can choose and they can pursue the allopathic degree.
correct.
Then this is about the allopathy, meaning Ayurvedic doctors can go for the allopathy. Now, what about the other things? So as we were discussing, like other fields are also there. So what about the government job opportunity?
So same how the central medical officers or MOs are there in the this thing, medical field. Ayurveda also have Ayush officers are there, sir. So you can go for the Ayush. There will be exams. Every 2-3 years seat will come. Every district have 2 or 3 this Ayush officers. So there
What about competition
competition, sir, is not
compared
that
to
much.
allopathy?
Compared to if I talk about MU, it's very less. Because the colleges are less, number of pass outs are less.
Salaries are exactly same.
Correct. Exactly same. The first rate,
Bucks and everything. Basically,
everything exactly same.
different.
You are taking that course only. Normally, you are a medical officer now. Ayush, but only thing is ki there only medical officer here is you are Ayush medical officer. Ayurveda medical officer. You are.
Then let's talk about the private hospitals.
Private hospitals. If I tell you,
I see
50% of the very big private hospitals, the doctor, 50% of Ayurveda doctors are working.
Yeah.
This is the
because
ratio.
legally settled.
Yeah.
And the
So-
number of doctors are not available, or sometimes they are very costly. So they'll go for cost effective manner.
So Ayurveda doctors are working in the this medical field.
Inside the hospital, what matters is whether you
How-
are good or bad.
Yeah. How like you can treat the patient or not.
Simple.
Simple. You can cure the patient or not. Only thing matters is that. And basic knowledge Ayurveda also have.
And almost each and every good hospital nowadays are having the welfare wellness center.
Wellness center. So yeah, that is
For that, they have to hire. Now that they are having the Ayurvedic centers as well. The thing is, the Ayurvedic doctor can go for allopathy, but allopathy cannot go further.
And so nowadays, this mental illness is very much more compared to this normal illness. So in Ayurveda case, maximum all are actually your patients.
Yeah.
Like in
Statistically speaking, basically allopathy starts once you get ill.
correct,
Ayurveda starts once you get born.
correct. So all 100% patients are yours. You can
That's your market basically. So it's not like treating the patient. Basically, it's about treating the illness.
correct. Your prophylaxis you are giving, you are simply assuming that it's not happening this time. So you should not fall ill. If you will follow all the Ayurvedic things, the getting the disease is difficult after that. So this is a basic thing.
At the same time, I keep seeing the more and more people keep opting for this. More and more people. Just my example, I'll tell you. Basically, at one point of time, I was having some issue with health, and I was trying to take the appointment of one Ayurvedic doctor. I was getting it after 21 days. Appointment I was getting after 21 days for the doctor.
That was value they are carrying now.
21 days I had to wait basically to get the appointment. And I'm a lazy person, so I was not able to track that. And I was forgetting that when the appointment was coming, I was forgetting basically. So they are very, very high demand.
Highly
It's a very high demand, especially in the metros, very high demand of Ayurvedic doctors. But you have to be good. You have to be.
You have to be good enough field. That's
You
the
are-
main thing.
So you cannot go for the Ayurvedic field and keep crying like I don't want the Ayurveda and I want to go for allopathy. That will not work. In that case, you will not be good in the field.
Other
you are
field
going.
also. Like in that case, you
any
go any of the field. You have to work. You have to get in your field.
I
whatever you
know
are
many
working.
people who have gone for vet, who have gone for Ayurveda and keep preparing for just to clear
That's it. For 6 years, 5 years, you are simply taking those things.
the fruitful years, the productive years,
Yes, you are
maximum productive
wasting in
years
the-
are wasted. So that should not be done actually. even outside nahi jana hota. We have seen the case which happened in the Ukraine. Parents were crying for their kids.
That time.
India, there are opportunities, there are colleges are there. Opt for them. So,
Try to
but
go
so
outside.
rush for the MBBS ultimate. Okay. And what about like the market product side?
Okay, so product side is there, sir. Mainly pharma. The all human pharma or animal pharma or whatever, all industry are running on Ayurveda.
Ayurveda is there.
Ayurveda is there, sir.
So vet is making for vet only. Human one is making for human only. Ayurvedic is making for all.
Everyone, sir. If I'll give you examples, Himalaya. If everyone know the company, it's a very big company, and if you will see the class of products, they are
making for humans, they are making for animals, and
they are making everywhere. They are everywhere in the
and who
not
is making
India
them?
only. They are foreign. They are
doctors.
there.
Ayurvedic doctors are sitting there ultimately.
Ayurvedic doctors will be there. There will be separate posts for Ayurvedic doctors.
Research will be there.
So then Dabur you can take, then you can take this Patanjali, sir. The boom what the Patanjali has brought from last 10 years.
Yeah. Thanks to Patanjali, this field has
grown. Patanjali
has Baba Ramdev, he has changed the scenario
of Ayurveda. And nowadays,
it was there, but the limelight he had put on this field, basically. It's mind-blowing, basically.
And yeah, so Baba Ramdev also have one more thing, sir. There is separate diploma course which is called as Yogic Sciences.
Okay.
And so after doing Ayurveda, if you are opting that is 6 month to 1 year course, Yogic Sciences, and the opportunities in foreign is so much after doing that.
Yeah.
Yogic
so many Ayurvedic doctors are there, but the Ayurvedic doctors is limited. Yes. Because Ayurvedic is happening only in India.
India only.
The demand in the India, we are not able to fulfill. That again thanks to Baba Ramdev.
And Modi is like giving very much importance. Yes. The budget is very good for now for Ayurveda field. Yeah. Research, etc. They are doing very much good.
Because the thing is, this is something which is connected to the wellness. The idea is basically that people should not get ill. So this medicine is about people not getting ill.
Yeah, because nowadays the
correcting the problem at the origin itself.
Correct. Yeah. COVID also like this, they have done a good amount of work in this Ayurveda field.
Basically, what about research and all?
So research, you can, after that, you can go for SRF also. There are this senior research fellow seats are there. Then you can do PG, you can do PhD also. You can become an assistant professor. Then separate, there is a government post, which is called as Ayush Research Officer, which is mainly based for research only. The government is giving so much huge amount of budget for research. So, example, if I talk agriculture, they have ICAR. ICR is which is mainly for research purpose. In veterinary, they have IVRI. Same like in Ayurveda also, they have given huge amount of investment for the Ayurvedic research. So Ayurvedic research institutes are already developed in India, which are only taking the research ones.
So basically, like this is actually it's not a growing, I should not be saying it's a growing field, it's a very old field.
But now,
thanks to the scenario,
coming back.
Thanks to the scenario, thanks to the RPM, thanks to the Baba Ramdev, basically this has come into the limelight. And it's a very prospering field, very promising field, even in India and outside. It's a very promising one. And I again say, sending your kids to do the MBBS outside, it's not an option. It should not be the case. They can opt for the Ayurveda easily.
Easily getable. So this thing fees is also not that much higher.
Economical wise also
fine.
It's quite
and the future is also scope is good. It's not
for entrepreneurship. It is a
mind-blowing scope, sir. Like
I go for resorts basically. Generally, 5-star resorts almost
all contain wellness centers, sir.
Almost all are contain wellness.
Sir, if nearby only, if you see, there are 3 to 4 wellness centers in this area.
Yes. So every wellness center obviously will be backed by some Ayurvedic doctor.
Obviously, they need Ayurvedic doctor.
It will be backed. The thing is, if you are, then opportunity comes for wellness centers. Capital is required. That capital you can arrange, and you are the main asset.
Sir, the therapies like this Panchkarma comes, then there is a cryotherapy. There are so many things which are coming new in the Ayurveda, and they are using it. They are getting results from that.
So the thing is, it's a good field to go for. If you want to go only for MBBS, then sometimes the repeat is required.
Correct.
And if you don't want to go for the repeat and wants to practice the allopathy, then Ayurveda is one field you can go for, because if you go for the Ayurveda and you become the doctor there, then you are legally entitled for allopathy. You can prescribe the medicine legally. You can go for allopathic hospitals. You can practice allopathy. And other than that, basically the Ayurvedic field is completely open for you, which nobody can come ultimately. Okay. So I think we have given enough. And in time, due course, we'll be making more videos about the other fields as well. to give the realistic idea about the other fields and the opportunities about the other field. Okay. I hope you like it. Thank you.
Thank you.